Hello, CGT. This is the 2023 open enrollment video. Today, we are going to be covering all of these very generous benefits from CGT, medical, dental, vision, life insurance, disability, and new just for this year is pet insurance. All of it is COBRA eligible, meaning you can take it with you. Right now is open enrollment. You can make any decision you'd like to add a qualified dependent onto the plan or take them off. Outside of open enrollment, you cannot change your election unless you have one of these bullet points going on during the middle of the year: marriage, divorce, birth of a baby, spouses open enrollment, things like that. We've got pretty good news this year. We are sticking with Blue Cross Blue Shield. Blue Choice PPO is their network. We have the exact same three plans. They are all PPO plans. They all cover preventative. Those are your annual physicals, mammograms, pap smears, things like that. Going to the doctor is on a copay. That's just a flat rate when you use it. Retail clinics are on a copay as well. Virtual visits 24/7, 365 via MD Live are all $0 copays. You've got 3 different deductibles. That's what's going to be asked of you when you go into a hospital setting. Then your out-of-pocket maximums down here where you see my cursor are 3 different numbers. And that means your all services covered in-network services, your maximum financial liability is either individual or more if you have a family. None of those numbers changed from last year. Our job at Catto&Catto and Hub, which my name is Ben, forgive me if I didn't introduce myself, is to make sure that when we are talking with you, these are the absolute best value plans, and these in fact are. So maximum liability is down here. Your deductibles on these 3 different plans, good, buy up, and the low deductible plan are here. Urgent care is all on a copay. Diagnostic lab will be a difference if you get it done in the physician's office or outside of it. And again, none of these are changes. And then you've got your prescriptions, preferred and non-preferred. The only difference there is just the location of the prescription. CVS is not contracted with Blue Cross and Blue Shield. Can you still go there? Sure, you can. You're just going to pay a little more for it. So depending on the type of drug that you are prescribed, it'll either be preferred or non-preferred based on where you go, and it'll be on a different tier of coverage. Prices are here. These are some of the best prices that we have in all of our clientele, and we're fortunate enough to be able to continue working with CGT, providing great benefits. This is the same. It's just an FYI. This is called Blue Access for members. You can go to bcbstx.com. You can find EOBs, contracted providers, get a new ID card. You can also find all that on their app, which is listed right here. This is MD Live 24/7, 365, cold, flu, ear problems, pink eye, things like that. They also have behavioral health, which is a great add-on for consideration through MD Live. You can call them on the phone. You can use a computer and then speak with a doctor. You can also use a handheld. Biggest information on this slide is the hospital emergency room will generate the same bill as a freestanding emergency room. If you see one of those signs that says see a doctor in 6 minutes, that is typically a freestanding emergency room. So just know where you're walking into before you access care. The Guardian plan is the network access plan. That's the name of the network. This did not change from last year. Every mouth that's covered on the plan gets $1,500 to apply towards covered services. Yes, you get some ortho. It's only a one-time deal for adults and kiddos. Preventive services that I'm scrolling over right here are $0. The deductible is waived. That $1,500 applies to things outside of preventive services. Costs are right here, and these did not change. Vision is also with Guardian, VSP Choice Network. You pay a $10 copay, and then you've got a decision to make. Do you want your $150 stipend to go to frames or to contacts? Can't get both at the same time covered by insurance. $150 stipend, and then they'll take a discount off the balance. Lenses are on a copay, $25 unless you're really blind like I am. You're probably paying more for that. costs are here, and these did not change. The different retailers are listed down here. Guardian is also our life insurance. Everybody gets $50,000. It does not cost anything, but make sure you update your beneficiary information. That's who gets the proceeds of the life insurance if you're no longer living. We also have extra life insurance. When you go online to Paycom, what you'll be able to do is you'll be able to move a button to see how much this will cost you. If it's your first time, you'll be able to apply for about $100,000 with no questions asked. If it is not your first time, then you will have to apply for coverage that is called evidence of insurability. And so sometimes there's paperwork involved. Well, there's always paperwork involved. Sometimes there's a blood draw, but not always. It just depends on the application process. But the point is, it's not automatic. You'll be able to see that online as well. These are the costs, but it's easier, honestly, to view it online. That way you can get that auto calculation done for you and see if you want it. Long-term disability is free to you. This is a wonderful benefit to not have to pay for. $10,000 a month, up to 60% of your pre-disability earnings, up to 10 grand a month, is insured in an insurance policy. It kicks in after 91 days, and it goes to age 65 till you're 65. So this is sick or hurt, can't come back to work in any capacity. God forbid you have an insurance policy that protects up to 60%, 10 grand max per month of your income. This is the new offering this year, Wishbone Pet Insurance, wishboneinsurance.com, CG Tower. We've got all sorts of different coverages for Fluffy and Buffy. The actual rates are based on age and breed of pet. What I would say is this is good for future conditions, not current conditions you're looking for an insurance carrier to pay for. So it's not going to cover pre-existing conditions, but if something new develops, that's really the place that this would serve. And this is direct pay. So if you enroll in it, they'll send you a bill and you will directly pay Wishbone. Pretty interesting coverage. Because this is the short and sweet version, we are not going to go over everything as it relates to Wishbone pet insurance. We actually get a ton of requests for pet insurance because dogs and cats are expensive. Some good FAQ are here also. You can also call us in our office to ask more specific questions, and we can help follow up with anything that you might need. But the vendor is called Wishbone, and our contact information, if you want to reach out and ask some more specific questions about Fluffy or Buffy, then you can do that. Got 3 face-to-face visits. Look at that. 3 face-to-face. It's provided by Guardian. It does not cost anything. So this is a great resource for some face-to-face talk therapy and counseling. Premium only plan simply means any benefit that we can pass from CGT to you without taxation. We'll do it. Gold's Gym, we still have that going on, $27.99 a month. Talk to HR. Gold's Gym is all over the place. See if it's a new year, new you in January. This is great late night reading material we are not going to cover. Just for the sake of time, you can do that on your own time. And here is where we list all contact information, all vendor information. You have your superlative HR, Leslie, and then you have our contact information, and then each of the different carriers' contact information. And then a glossary of terms just in case you didn't have enough on the previous pages. So with that, we will stop for today. Thank you very much, and let us know if you have any questions. Bye-bye.